After nearly 2 decades of waiting by successive sets of students in its Department of Nursing, the Nursing and Midwifery Council of Nigeria has approved the internship program for Enugu State University of Science and Technology Teaching Hospital. The council also approved indexing of nursing students at the College of Nursing, as well as the former School of Nursing Agu, which was recently upgraded to the College of Nursing. The approvals were announced by the Registrar of the Council, Dr. Farouk Umar Abubakar, when he led a delegation of the Council's accreditation team on a courtesy visit to Governor Peter Mba, where he commended the governor for providing the requisite infrastructure at the affected nursing institutions. The Registrar also spoke highly of the governor for creating a conducive environment for teaching and learning. For a chat on this subject, we're now being joined here by Dr. Yomi Jaye, who is a special advisor on health matters to the Enugu State Governor. Good morning and welcome to the show.
Good morning, Nigerians.
Good morning.
Good morning. Thank you for being here. I mean, first of all, I have to say congratulations. It's like breaking a jinx after 19 years, especially in a time where we're having this jackpot syndrome with doctors and nurses on both hands. Now, what exactly, were the specific challenges that led to this 19-year delay in approval of the internship and indexing Enugu State nursing institutions? And what do we have on ground now? What's the next steps?
Having gotten to the office, the governor, a very proactive and forward-thinking governor, Barrister Peter Mba, saw a couple of gaps, and that was not expected. We had Nursing Council had already said all School of Nursing should transition into the collegiate status, and the last day of that transition will be December 31, 2003. If you don't, then your school will be scrapped. That was one. Then the second part of it was that the Department of Nursing in our teaching hospital, Enugu State University, had no accreditation. Had no accreditation by the NUC, Nigerian University, the accrediting body for the university, NUC. Had no accreditation from the Nursing Council as well. What that means is that all the students have been in the school studying nursing. In fact, we do not have any accreditation to start the department at all. So, and they've been there. So immediately, His Excellency came into office. He saw these gaps. What it means is that the young people of Enugu State, they don't have the access to actually go into nursing. We're producing just 50 nurses in Enugu State every year. That's grossly inadequate with the population of about 7 million. And the young people making the large population. And you can see the impact of nurses across the world during COVID. We have the people, but why are we not having that? So the first assignment I had was to see that these colleges, this nursing, School of Nursing comes to become a college. And that means that we needed to involve the NUC, we needed to involve the Nursing Council, we needed to make sure that all the things that they need, they are available. So we swung into action. And we went through the process. We first secured the fact that our School of Nursing should not be scrapped. Then we went to NUC to make sure that they assessed the place, they told us all the things we require, and then we put them in place. They came back and they got it approved. So we now had the Nursing Council to face, and then the MBT people. So that was what we did recently. So what His Excellency said was that from 50, he has a very audacious mind in setting audacious goals. So he wants us to produce 3,000 nurses every year. You can imagine from 50 to 3,000, and that's huge. What that means is that you're going to be having about 4 or 5 campuses across the state. You're going to be having a lot of infrastructure to be put in place and all, which is committed to doing. And of course, with his foot soldiers, we went around to see what are the gaps. We listed them. We needed a CBT, a computer-based testing center is a requirement. We needed their simulation laboratories to be optimal. We needed their chemistry, physics laboratories to be optimal. We needed more staff to be employed and recruited and employed. So all those things, we went through the process over a few months, and we said our target is to make sure that before the 365 days in office, we must achieve this. So it's a big news, but to us, as if you compare it to the goals that we have, it's just a tiny bit, because it's just what it's supposed to be. If I say that this is a big, huge thing, breaking 19 years is big, is a big thing to achieve, but it's just the beginning of what we're going to do in Enugu State. So what it translates to for now is that they've been able to say that we can now have, we've provided the resources that will make us be able to...
One second. I'm so sorry.
I'm so sorry to interrupt. We're going to have to go on a short break again. I don't know. Another technical glitch, probably because of the weather. We'll be right back. You're still watching the morning show here on Arise News. Thank you for staying with us. We still have in the studio Dr. Yomi Jaye, who is the special advisor on health matters to the Enugu State Governor. Are you about to wrap up on the work that is currently being done to achieve this 3,000 nurses a year landmark?
So with this clearing the way and making sure that the Department of Nursing that's had about 4 sets that have not been indexed in. Indexing means that we give you a number that we now agree that you are in training to become a qualified nurse. The uniqueness of qualification as a nurse in Nigeria is the fact that you have 3 specialties as you finish in the teaching hospitals. 1, the midwifery, 2, public health, as well as general nursing. Yeah. It's not done in most parts of the world. They just face 1. So when any Nigerian nurse travels like that, he's able to put hands on different things. And that was what the registrar said. So now, the 4 sets, the backlog that have been there, that you see them texting, sending email and all that, that they are hopeless because they couldn't do professional exams. All of them, the registrar approved that they will be indexed and they will have their exams this year, November. So His Excellency has said we should go and make sure that they have an update course so that they can pass the exam. So by next year, we don't have any backlog. That's a breakthrough. The young people in Enugu State, they are rejoicing for this. Now, the second part of it was that the school that was supposed to be scrapped because it's not going to get to become a college. Yeah. The 2 of them are now up to date, and then the MBT people, MBT, the National Board of Technical, which has to approve the collegiate status, has told us that in 2 years they are coming back, we can start our program. That's a big win for us.
Would that be a 2 or 3 year program?
No, it's going to be a 4-year program. So they won't be doing 3 years again. They will do 4 years, and by that time you'll be able to have your nursing, your midwifery, and public health in 1 degree.
All right, let me ask you this. I mean, congratulations, no doubt, to breaking the jinx and everything. But then, if you train 3,000 nurses a year, maybe from by the time the governor will be leaving or ending his first term, how much of that figure do you think will stay in Enugu or will stay in Nigeria, given the fact that your governor was part of the decision to say that is unable to pay beyond 60,000 minimum wage. And therefore, if you now train a nurse, well certified and everything, how do you stop them from saying, oh, the next point of call will be Dubai or the UK or Canada, where I will earn 2 times or 3 times what Mr. Peter Mba is earning as the governor of Enugu State?
Thank you very much. And I appreciate the fact that you brought the question up. I'm only able to speak for my governor. Now, Japa syndrome is a multi-pronged problem. 1, infrastructures are not there. 2, I mean, generally. 2, not just in Nigeria, Africa, right?
As far as health sector is concerned?
Yes,
or generally?
Generally. So, infrastructures. 2, the remuneration. 3, welfare, security, among other things. And when His Excellency Barrister Peter Mba came to office, his approach is also multi-pronged. Now, the schools that we are doing, that we are getting accredited and put in place, is just 1. Immediately he got to office, the nurses have been paid part of their what they call con-ens. I can't really know the details, but it's a kind of salary package that is not been done. He approved it. And we are not stopping at that. Now, we are also bringing the programs that does welfare. In those days, maybe in the 70s, when you finish as a doctor, one, you have a car, you have a house, and all that.
Yeah.
Now, those packages are also being put in place. Increasing the number of outputs is just one out of, and behind the scene, His Excellency has a huge intention not to stay around what we call the minimum wage. Our doctors and nurses, the plan is to improve generally their welfare. And of course, it may not be...
It starts from the salary.
Yes, of course, that's what I'm talking about.
Yeah.
It's part of what the plan is to improve their salary. And the basic thing was the ones that are not being paid before, we first clear them. And that's a very good intention and the starting point. And with just 1 year in office. Let me mention the fact that the residency program, there is a bulk money that is being paid to them for their training. It's never been paid. For the first time, we ensure that before the 1 year in office, they were paid. And we're still planning that it is annually that is going to be given to them. So it's not just to increase the number, which is to plug the people that are going, right? Yeah. But the resources and then their welfare is also being taken care of.
Thank you. Now, we've spoken about the minimum wage, we've spoken about your accomplishments, but one thing I want to ask about is, you said you're a public health doctor, you're a public health professional, and you spoke about the lack of infrastructure, but right now in Nigeria, we're facing crises. We're facing a hunger crisis, food security crisis, cost of living is quite high, inflation is high. What role do you think that nurses need to play to plug the gap, considering this Jackpot syndrome? You know, it's been reported that children are dying of malnutrition 100% higher in some areas in Nigeria than they were at this point just last year. So considering this critical public health crisis, what role do you think nurses would play? And also, I want you to speak a little to the cholera outbreak right now, and what role you think that the role of public health in preventing such crises from occurring.
Thank you. So, anything of public health concern is basically education. And doctors, if you look at the deep meaning of doctor, a teacher. The nurses as well, they are the ones that will inform the patient on what to do and what not to do. One of the roles of primary health care is to make sure that the patients are close to the place where they can receive health care. But then in the healthcare, you see, in those primary healthcare, they still have what they call infants welfare clinic. It's not for anything, it's not for treatment, it's just to inform mothers, this is what you need to do, this is what you need to do when there is cholera, this is what, if the child is vomiting more than, so this is what you do. And also the role of a nurse is very critical. And making them comfortable to stay in the soil of, see, personally, I have a mantra, changing the face of healthcare system in Africa. I work in Albuquerque for some time, in New Mexico, and I've worked in different places. We could have gone. The mission is aids and donations are never sustainable. It is intentional partnerships and collaborations where, oh, you are bringing aids, no, don't bring aids. What can we invest in? What can you do? What can we do together that will benefit you and not benefit us? The people bringing aids and donations, they have intentions. So, but we have so unique doggedness in us. And from that, we see that if we are able to make sure that our whole environment is suitable for the people to work, they will stay.
All right, Dr. Jaye, before we let you go, because we are struggling with time, just two quick things. One, why is your government building another 260 is a bed primary health center? And then Yomi, Jaye, Is a Yoruba name, even though you are wearing, is it Siagu?
Red card.
What's the connection? Is the governor your friend, from Oyo State to Enugu State as a special advisor?
So let me start with why is the governor building
260.
260?
Yeah.
The governor is not building different news. We did an assessment.
Okay.
We have over 500 primary health care and primary health centers.
Yeah.
And 80 to 90% are not functional. So we did an assessment and we picked 260 locations, 260, yes, to represent each ward.
Okay.
What we want to do is to fulfill the 3 A's of primary health care: accessibility, affordability, and availability. That's what we want to achieve. But we look at those
You're not
ones.
building, you're refurbishing them?
So there are some places that don't have.
Okay.
We build.
Okay.
There are some places that have that are not functioning. We refurbish. We put it together. What we want to do is to have a primary healthcare center that is able to have healthcare givers 24/7, digital, internet, and all the things that they need that can make them to run to town. Right? Like I said, I worked in Albuquerque. You go to a village in New Mexico. It's called Mora. If you Google it, it's a far village. It's like going to, I don't know, maybe somewhere down, Jaye, inside Jaye or something like that. You get there in the farm, I will see internet. You get there, you can, if you have an emergency, you can see defibrillator nearby you. So that's what His Excellency is templating.
Okay.
So that's one.
Yeah.
Number two is the fact that these things, if we do not get them up, we will still have it decayed. In the years back, we have primary health care centers across the nation working very well. If this works, we will have little number of people going to the secondary care. And then we have little number of people needing tertiary care. Most of our healthcare needs, 60 to 80% are primary. Now,
Right.
because I know you're Russian, you said Yoruba and all that. I go back to when we were young. Look at the map of Nigeria. You just look at plain map of Nigeria. You see Lagos, Ibadan. You see Kano. Then you see where again? In the east.
Enugu.
Fantastic. Enugu is a consequential city. It's a cosmopolitan state. And the governor has that mindset. So anyone that he feels he can add value to the place will bring on. That's why the Yoruba man is here. Tomorrow is here.
All right.
Thank you.
All right, then congratulations, on this achievement. 19 years, breaking that streak is not easy. Dr. Yomi Jaye, Special Advisor on Healthcare Matters to the Enugu State Governor. Thank you for your time here on The Morning Show.
Thank you.